Hello everyone, I'm Dr. Sidana, obstetrician gynecologist, Astha Medicare. Today I'm going to speak about endometriosis. What is endometriosis? It is a painful disorder in which the cyclical periods they become painful. Tissue that involves the uterine cavity, that is endometrial lining, also comes outside the uterus. So this is known as displaced endometrium. It involves ovaries, fallopian tube outside of the uterus, as well as the whole abdominal cavity may be affected because of endometriosis. What happens in endometriosis? That this displaced endometrium, which is lying outside the uterus, also undergoes cyclical changes as the uterine lining is also undergoing. So it thickens and it breaks down and it bleeds as the patient has cyclical periods. Under the effect of hormones, this lining, which is lying outside the uterus, also thickens and bleeds, and it doesn't come out. As there is no exit, this blood get trapped inside the ovaries or the inside the abdominal cavity. In the ovaries, because of collection of blood, it leads to formation of endometrioma or chocolate cyst. Because of this blood collection in the abdominal cavity, pelvic as well as the abdominal lining get irritated, and it leads to formation of fibrous band inside the abdominal cavity. As a result of this, the various organs of the pelvic cavity like uterus, tubes, ovaries, as well as rectum lying behind the uterus and the bladder in front, they stick to each other and lead to scarring. How does the patient present to us? The typical symptom of endometriosis is painful cyclical bleeding. Normal slight cramping is normal during periods, but in endometriosis, there is extreme pain which starts before the periods, may last during the periods, and after the periods also. So patient feels cyclical painful bleeding, and that painful cycle lead to disturbance in her daily routine activity and affects her quality of life. Because of severe dysmenorrhea, patients are not able to do her daily activities, even they are not able to resume their job or work. It also lead to pain during intercourse as well as during periods. Patient may feel pain during bowel movements as well as urination. This is known as hematochezia. As well as patient may not have any symptoms because of endometriosis. So the severity of the pain is not related to the extent of endometriosis. Sometimes patients having mild endometriosis, they present with severe pain, but otherwise in other patient having severe endometriosis, they will not feel any pain, and they are diagnosed only when they're coming to us. Because of endometriosis, the whole anatomy is distorted and patient may have difficulty in conception also. So most of the patient, they present after marriage when they feel difficulty in conception. So they are mainly approaching us when they are not able to conceive after 2 to 3 years of their marriage, and they are diagnosed at this time due to that they are suffering from endometriosis. Now, what is the theory behind it? There is no exact cause known till now which leads to endometriosis. One explanation is retrograde menstruation, that menstrual blood with endometrial cells which is coming out of the uterus every period, that flows retrogradely and it lines the ovaries, fallopian tube as well as the abdominal cavity, which leads to endometriosis. Second theory is that because of that is known as induction theory, that the cells lining the abdominal cavity as well as peritoneal cavity, they undergo transformation, and those peritoneal cells, they convert into endometrial cells and they respond to various hormones and lead to cyclical changes in the displaced endometrium. Third, last but not the least, we have seen that patient after hysterectomy or after cesarean section, they develop surgical scar endometriosis. That is, the endometrial cells, they invade the scar tissue and that lead to formation of surgical scar endometriosis. So what are the risk factors for endometriosis? One is late pregnancy. Second is starting period at an early age. And third, achieving menopause at an older age. Patients who are exposed to the periods at early age and those who achieve menopause at later age, they're more prone for endometriosis. Then reproductive tract anomalies, they also increase the risk of endometriosis, as well as patients having low BMI, they're also prone for endometriosis. Now, what are the various complications due to endometriosis? As I have told, because of endometriosis, there is alteration of anatomy, that is distorted anatomy between the uterus, fallopian tubes and ovaries. which leads to, because of fibrosis due to lesions, so it leads to inability to conceive. So, what are the various complications which may arise in the long run because of endometriosis? One is, as we all know, it leads to cyclical painful bleeding. So, patient they become scared of endometriosis, of their periods. It affects their daily quality of life during periods, and irrespective of day of the cycle. Then, second comes infertility, that is difficulty in conception. As we all know, because of endometriosis, there is distortion of the anatomy between the uterus, fallopian tubes, and the ovary, which leads to difficulty in conception. Then, because of endometriosis, studies have shown that patients, those who are suffering from endometriosis, they're at increased risk of ovarian cancer. Now, how to diagnose endometriosis? We have different diagnostic modalities by which we can diagnose that patient is having endometriosis. One is clinical symptoms, that patient is having cyclical painful bleeding, and associated with other findings on ultrasound, MRI, which are suggestive of that patient is having bilateral ovarian cyst or single cyst. And the gold standard for diagnosing endometriosis is laparoscopy. Laparoscopy, we can, with the help of laparoscope, we can visualize the directly uterine, fallopian, and ovarian relationship, as well as we can diagnose the extent of disease, and simultaneously we can treat it. Now, coming to treatment, depending upon the age group and the presenting symptoms, we treat the patient. If patient is young and having mild symptoms of endometriosis, then simple NSAIDs will work. If patient is having problem in conception, then we give the treatment according to that. And we have nowadays we have various suppressive therapies available to suppress the cyclical changes in the displaced ovarian tissue, so that endometriosis doesn't grow and doesn't cause any further distortion in the anatomy of the tubes and ovaries. And we advise the patient to conceive as early as possible after the marriage, because pregnancy has a suppressive role on the endometriosis, and we have seen that sometimes endometriosis get resolved after the pregnancy, and it is completely resolved once the patient achieves menopause. Thank you.